Hello, welcome to Fine Today. Today we will talk about the dangers of cosmetic surgery with Fine Tomorrow. Firstly, we will talk about why do people do cosmetic surgery? And now we will move on to our expert.
Why people have cosmetic surgery? Well, they might have an accident or birth defect. They also might want to enhance their attractiveness in people who feel some aspect of their body size could be changed or improved. It would make them more attractive to others.
Wow, that's very interesting. Now we will move on to our first point, fillers and Botox. So, what is the problems with fillers and Botox?
Let's talk about Botox and filler. They basically have the same property. Both of them are used to make the skin more fuller by injecting the chemical into the skin and make the skin fuller, like this picture. But what's the difference between both of them? So Botox is used medically to treat certain muscular condition and cosmetically to remove wrinkle and temporarily paralyzing muscle. It is made from neurotoxin called botulinum toxin that is produced by bacterium Clostridium botulinum. On the other hand, fillers are a cosmetic treatment used to smooth wrinkle or pit scar in the skin, usually on the face. They are also used to make the lips fuller. There are many kinds of injectable filler, including hyaluronic acid, etc., etc.
Wow, I didn't know they were different. But as you can see before, there are dangers with both Botox and fillers, as you can probably see from these examples and even here. Now we will move on to the lab to see what are the causes of these problems.
So the danger of Botox are pain, swelling and bruise at the injection site, headache or flu-like symptom, droopy eyes or crooked eyebrow, crooked smile and drooling, eye dryness or excessive tearing, and also Botox will last for a short period of time. After a while, let's say 3 weeks, it will disappear and you have to be injected with the same chemical again. For filler, you get bruising, redness, swelling, pain, tenderness, itching, rash, and may cause allergic reaction in some people. And also, it can move from one side to the other side. Also, there can be a leak coming out. They can cause blindness in some patients and also a stroke and injury to blood supply. So how it works? Let's say this is a normal size of the face of a person. Let's say we inject Botox or filler, it will become larger. But for Botox, as you can see, it will become smaller again. But for filler, it will stay there and it will stay like that forever basically.
Oh my Einsteins, that is certainly scary. Now we will move on to our next point, breast implants. And now we will talk to our expert.
Let's talk about breast implants. People do breast implants to increase their breast size, and there are 3 types of implanting. First one is putting the saline bag or silicone bag in front of their muscles, inside their muscles, and between the fat and the muscles. And do you know about the danger of doing breast implants? Let's talk about the danger of breast implants. One of the danger that you might face is changes in your nipple position and loss in sensation. This picture is an example of changes in nipple position. As you can see that one is above, like up here, and one is down here, and it doesn't look good. The next complications that you might face is the problems in breastfeeding. When you grow up and you might want to have kids, but the silicone inside block the glands in producing milk, and that might cause into problems when you're producing those milk for your children. However, one of the most severe problems is the rupture. What is rupture? Rupture is a bursting of your silicone bag or saline bag, and those substance inside of those bags leak out of the bag. Okay, we'll show you the example of when the substance leak out. As we know that the balloon is an example of your your silicone bag. And by puncturing this balloon, it will replicate the rupture of your silicone bag. This balloon is an example of silicone bag or saline bag with capsular contracture. Capsular contracture in Thai is pang phoot. As we can see, there's a contracture outside the silicone bag, and when the rupture happens, the substance inside will not directly leak into your body, but will remain trapped inside the contracture. Okay, and we'll show you the example of the rupture. As you can see that the substance leak out, however, the substance remain in the bag. And this process will happen exactly the same when the breast is in your body.
That was a great demonstration, and you would say it's a blast. Now we will move on to our last point, the dangers from external factors. We have a special interview with Dr. Drew Peacock.
Today we have special interview. We are with Dr. Drew Peacock. We will talk about the possible danger from the external factors. So, what are the problems?
There are many dangers to do with cosmetic surgery from the side of surgeon. A surgeon can easily make mistakes like leaving equipment inside of the body, accidentally cutting the wrong nerve, causing nerve damage, and problems with anesthesia are also possible during surgery. Another problem is the sanitation of equipment. There are risks of infection if the surgery is done unhygienically, which is common from cheap or knock-off plastic surgeons.
So, what are some of the illnesses we can get from cosmetic surgery?
Aside from infections and nerve damage, there are also risks of organ damage and scarring. This is common in liposuction as it works in the inner parts of the body where the organs are. Other problems include seroma and hematoma. These are caused when blood pools inside of the body, possibly due to surgery and causing bruise and swelling.
Thank you for your time, Dr. Drew Peacock.
Going to do cosmetic surgery? No? Good! That